Hey everyone! Today we'll be talking about childhood disorders. Thank you to everyone who is watching this workshop, and we appreciate your interest. Autism Spectrum Disorders, or ASD, autism is considered a spectrum because many symptoms that range from mildly to severely disabling. The symptoms of ASD are mood and anxiety disorders, seizures, intellectual disability, attention deficit hyperactivity disorder, and/or obsessive compulsive disorder. Despite this long range of symptoms, more than 40% of people with autism have normal or above average intelligence. Some are unable to speak, while others are socially awkward but articulate. So, how exactly is ASD diagnosed? ASD is diagnosed by two main criteria, which are impaired social communication and interaction and repetitive or narrow obsessive interest.
ASD's prevalence has risen dramatically since the 1970s, but it's unclear if changes to diagnosing criteria and the newly wider recognition of ASD have contributed to an increase in diagnosis. Although it should be noted that boys are 4 to 5 times more likely to be diagnosed with ASD than girls are, it is unclear if this pattern is attributed to underdiagnosis of girls. ASD also has notable environmental factors. Some notable factors that are linked to an increased risk of autism in children include parents having kids later in life, fever and infection during pregnancy, and premature birth. Last, it should be noted that many studies have found no correlation between childhood vaccinations and the increase in autism diagnosis.
Although ASD has some prominent environmental factors, ASD is particularly driven by genetics. The genetics of autism involves many genes. These genes lead to a unique condition in nearly every person. For example, recent research shows that many genes, each with a small effect, contribute to the inheritance of most ASDs. But small effects make these genes hard to identify in genome-wide association studies. Some fun facts about ASD's genetic factors is that one twin out of a pair of identical twins is diagnosed with an ASD. The other twin has more than a 50% chance of also being diagnosed with ASD. Children who have older siblings on the spectrum have a 1 in 5 chance of being diagnosed with ASD. What else do we know about genetics? Scientists are now looking at the rare genetic variations associated with ASD. These effects are larger and easier to detect. Some of these rare mutations are in single genes. These genes create impairment known to cause intellectual disability and social dysfunction. These genes include PTEN, which codes for a tumor suppressor enzyme that regulates cell divisions. Children with the variant of the gene NF1 develop tumors in children. It nearly meets 10% of the criteria for autism.
These ASD-related genes influence a major signaling pathway for regulating cell metabolism, growth, proliferation, and mTOR pathways. For example, mouse models with mutations in PTEN show traits similar to humans with these gene variants. They alter sociability, anxiety, and repetitive behaviors. These behaviors can be relieved or reversed by drugs that inhibit the mTOR pathway. This suggests potential for treating autism with drugs targeting the mTOR pathway. Excitingly, clinical trials of these drugs are underway. Because autism genetics are so complex, they cannot be used to diagnose the condition, and there are no biochemical or other biomarkers of autism. Autism diagnoses are based on behavior analysis, but efforts to use objective criteria are underway. It is noted that interventions are more effective the earlier they begin. Researchers hope that more objective measures will lead to earlier diagnosis and interventions. For example, parents often notice developmental issues before their child's first birthday, and autism can be reliably diagnosed based on behavior characteristics at age 2. However, most American children are not diagnosed until they are about 4.5 years old.
From a neuroscience perspective, ASD results from unusual development with the cerebral cortex, which is indicated by the left arrows. It is a brain region that is essential to memory, attention, perception, and language. In the cerebral cortex, white and gray matter of the brains show consistent but subtle alterations in people with ASD. The children on the autism spectrum typically have abnormally large brain volumes and faster brain growth. Other toddlers with autism have shown unusual development and network inefficiencies at the back of the cerebral cortex. In people with ASD, information might not be integrated in the usual way across distributed brain networks. You can see this in the infographic at the bottom right corner. In the autistic brain, the red arrows indicate the unusually rapid growth in infancy and early childhood, as well as atypical patterns of connectivity.
So now let's talk about ASD treatments. No medications have been proven to reverse autism. Medications are able to decrease symptoms such as anxiety conditions. Studies have reported social benefits from treatment with oxytocin, but the findings have been mixed. Behaviors therapy is still the only proven treatment for autism. And as noted before, early interventions are the most effective. The next disorder we will talk about is Attention Deficit Hyperactivity Disorder, also known as ADHD. It is one of the most commonly diagnosed childhood conditions. 11% of American children ages from 4 to 7 received an ADHD diagnosis in 2014. More than 30% of people are still diagnosed with ADHD in adulthood. ADHD is characterized by extreme and lengthy inattentiveness, hyperactivity, and impulsive behaviors. Kids with ADHD often struggle to form strong friendships, and unfortunately, their grades in school can reflect their behavior rather than their academic ability. Kids with ADHD may struggle with executive functions such as finishing what they start, remembering to bring homework back to school, and also following multi-step directions. Children with ADHD have lower rates of high school graduation and a higher risk of suicide compared to children who do not have ADHD.
ADHD diagnosis requires a comprehensive evaluation, including a clinical interview and a parent and teacher ratings, since no objective diagnosis test exists. Problems with attention and hyperactivity can be caused by other conditions, such as depression, sleep, and learning issues/disorders. The attention and behavioral problems must be severe enough that they interfere with normal functioning. Behavioral issues must be present in more than context. Although ADHD can tend to run in families, there is no well-defined set of genes known to be the root cause. Environmental factors can be involved. For example, early adversity, exposure to lead, and low birth weight. People with ADHD might have differences in the structure of brain cells and in the brain ability to remodel itself. People with ADHD can show unusual activity in brain cells that release dopamine, a chemical messenger, in rewarding behavior. There is no cure, but there are treatments that include drug behavioral interventions. Some things to know are that ADHD medications include stimulants as well as newer non-stimulant drugs, both of which are available in long-acting formulations. Determining the right drug and right dosage might require a period of experimentation and support from a specialist, since dosage is adjusted to how fast a child metabolizes the drug and to minimize the side effects. The effective behavioral treatments can include organizational support, exercise, and medications.
The next disorder we shall talk about is Down syndrome. For some context, Down syndrome is named for the English physician who first described it in 1866. 100 years later, scientists determined that possessing an extra copy of all or parts of the 21st chromosome caused the condition. People with this syndrome have not 2, but 3 copies of this genetic material. Some cases, the extra copy, otherwise known as trisomy, does not occur in every cell. Currently, about 250,000 people in the US are living with Down syndrome. There is no clear cause of the genetic glitch. Advanced maternal and paternal age is a major risk factor for Down syndrome. Mothers that are older than 40 are 8.5 times more likely to have a child with Down syndrome than mothers aged 20 to 24. The fetus can be screened for Down syndrome by testing the mother's blood. In the past, the risk of test procedures meant that only older mothers were screened. Younger mothers will not know until their children are born. The new blood test possesses no risk to the baby. Children born with Down syndrome have a flattened face and bridge of the nose, eyes that stand upward, and small ears. They usually have small hands and feet, short stature, and poor muscle tone. Their intellectual abilities are typically low to moderate.
There are other symptoms that come with Down syndrome, including hearing loss and heart defects. Unfortunately, most with Down syndrome will develop early onset Alzheimer's disease in their 40s or 50s. This is because people with Down syndrome have an extra copy of a gene in chromosome 21 that encodes the APP protein. People with mosaic Down syndrome seem to have milder symptoms and are more likely to survive past 50. Currently, there's no real treatment or any clear explanation of what occurs in the brain of someone with Down syndrome. We do know, however, that poor connections among nerves cells in the hippocampus are supposedly a key factor in intellectual differences in Down syndrome. Scientists have grown stem cells from fetuses with Down syndrome, and it was used to test potential treatments and confirm which molecular pathways are involved in the condition. In a laboratory study, the researchers took a gene that normally inactivates the second X chromosome in female mammals and spliced it into a cell that had 3 copies of chromosome 21. In these cells, the inactivation gene muted the expression of genes on the extra chromosome 21, which is believed to be contributed to Down syndrome.
The next disorder we will be talking about is dyslexia. It is the most common of the learning disabilities, affecting around 15 to 20% of all Americans. People with dyslexia have a pronounced difficulty with reading despite having normal intelligence, education, and motivation. People who have dyslexia may have trouble with pronunciation, lack of fluency, difficulty retrieving words, poor spelling, and hesitancy in speaking. People with dyslexia may need more time to orally respond to a question and may read slower than their peers. Dyslexia is usually diagnosed in elementary school when a child struggles with reading. Although reading skills and fluency can improve, dyslexia is a lifelong challenge. Deciphering printed letters, words, and recalling their sounds and meanings involve many areas of the brain. Brain imaging studies indicate that these areas can be less connected to people with dyslexia compared to those without dyslexia. One of these areas is a region on the left side of the brain called the world form area, which is involved in the recognition of printed letters and words. People with dyslexia also show less brain activity in the left occipitotemporal cortex, which is considered essential for skilled reading. Those with dyslexia appear to compensate for reduced activity on the left side of the brain by relying more heavily on the right side.
Genetic analysis have revealed susceptibility genes which can affect the migration of brain cells during development, leading to differences in brain circuitry. Dyslexia runs in families. Roughly half of dyslexics share the condition with a close relative. It is important to note that the genetics of dyslexia are complex and likely involve a wide range of genes and environmental factors. Treatments can involve behavioral and educational intervention, especially exercises like breaking words into sounds and linking sounds to specific letter patterns. Some researchers use the child's ability to rapidly and automatically name things as an early indicator of dyslexia. Treatments of targeting phonology and language skills show the greatest promise. The last childhood disorder that we will talk about is epilepsy. If someone has more than 2 seizures without an apparent underlying medical condition, they are diagnosed with epilepsy. About 1% of American children and 1.8% of adults have been diagnosed with epilepsy. The seizures result from irregular activities in brain cells. Contrary to popular belief, some seizures look like staring spells, while others can cause people to collapse, shake, and become unaware of what is going on around them. The pattern of symptoms and after-seizure brain recordings are used to distinguish between different types of epilepsy and determine the true cause of the seizures.
With epilepsy, generalized seizures affect both sides of the brain. The focal or partial seizures are localized to one area of the brain. A simple focal seizure can cause twitching or a change in sensation, which can trigger strange smells/tastes. The complex focal seizures can leave a person confused and unable to answer questions or follow directions. A person can also have secondary generalized seizures, which begin in one part of the brain but spread to become generalized seizures. With severe epilepsy, there are multiple types of seizure that can occur around the same time. Epilepsy has many possible causes and thus is considered on a spectrum. Causes include premature birth, brain trauma, and abnormal development due to genetic factors. The attributes of epilepsy patients, such as head size, movement disorders, and family history, suggest that genetics can be involved. The seizures can also accompany or cause intellectual or psychiatric problems. Epilepsy treatments attempt to control seizures with medication or diet. For most patients, a single medication is enough to control seizures, although a significant minority cannot get adequate control from drugs.
Half of epilepsy patients, particularly those with generalized epilepsy, can reduce their seizures by eating a ketogenic diet, which relies heavy on high-fat, low-carbohydrate foods. For severe cases that are not relieved by medication, doctors might recommend surgery to remove or inactivate the seizure-initiating part of the brain. In the most severe case, if one side of the brain triggers seizures on the other side, a split brain surgery will cut the corpus callosum, which is a thick band of white matter that connects the two sides of the brain. Once their seizures are controlled, people can resume their normal lives. Thank you so much for listening to our workshop. We hope that you enjoyed this workshop and have learned something new today.